Welcome everyone. Thank you for joining us for another webinar in our NetHope Solutions Center webinar series. My name is Madeline No, and I'd like you to welcome you to today's session, and we'll be talking about a tablet that can take it, testing a durable device for field use. And today our presenting organizations are ITU, PATH, ARM, and Accenture Development Partnerships. Before we get started today, I'd like to go over a few housekeeping guidelines for our session today. We'd like you to keep this an interactive session. Please post your questions and comments in the Zoom chat window, and we will have all those questions ready for our Q&A discussion toward the end of the hour. Later today, please look for a follow-up email that will contain a link to the recording for this session and any collateral that is included, links to more information, etc. And at the end of today's session, please take a moment to complete our webinar satisfaction poll. It's a great source of information for us to help make these sessions better, and we really appreciate your feedback. And with that, I will introduce Nicola Duty, Senior Manager with Accenture Development Partnerships, to kick off our session today. Over to you, Nicola.
Thank you so much, Madeline, for that. And thank you, obviously, to you and the rest of the NetHope team for inviting us to speak with you all today. I'd also just want to take a second to thank everyone who's dialed in to join us today and given up your time to join the call. We're acutely aware of just how busy everyone is at present, given the wider happenings and going on in the world, and they're so pleased that you've been able to join us. We're all very thrilled today to be able to take you something and some work that we're all really rather passionate and excited about, which I'm hoping will come across in today's presentation. But just to echo what Madeline said, we really hope that this doesn't become kind of a one-way conversation. You know, we're really keen to get your reflections today, tablet, thoughts on its design, other areas of use, and how we could make what is currently a prototype into a reality. Before I introduce the team, I do just want to kind of stipulate one thing. You know, community health workers have very much driven what we're talking about today and the tablet design, as will come to life as the panel speak. But we are aware that the tablet would be of use in other areas, you know, whether that's agriculture, refugees, education, just to name a few. So whilst the tablet was designed and tested with community health workers in mind, a key plus point of it is that it's not bespoke to healthcare. Anybody who really could have access, who doesn't have access to a regular power supply or needs a robust tablet, could benefit from the device. So we are therefore really keen to get your feedback, you know, irrespective of whether or not you're engaged in the healthcare sector. So following on from that, I should probably just introduce myself before I introduce the rest of the speakers with us today. As Madeline said, so I'm Nicola Duty. I'm a Senior Manager at Accenture Development Partnerships. For those of you who haven't come across Accenture Development Partnerships, or ADP, we are Accenture's social impact business, and we bring the capability and the power of Accenture to respond to some of the most pressing social and environmental issues. We've had the pleasure of supporting this project in various forms since inception, and are really excited to be part of this today. With us today, we've got Fiona Riggle. Fiona is the Senior Sustainability Manager at ARM, a semiconductor design company, and Fiona works on their Tech for Good projects, which support in the delivery of the UN Global Goals, and she's been our ARM lead for this e-tablet project. We've also got Henny Eskandar, and he is the Digital Services Senior Coordinator at the Digital Society Division of the Telecommunications Development Bureau of ITU. It's a bit of a mouthful. His involvement in the project has been very much in terms of helping us identify the requirements, assessing the needs of the best solutions, and Hanny was instrumental in this by facilitating various interviews and engagement with digital health practitioners coming from governments, NGOs, the private sector, and researchers. And lastly, but probably most importantly, we've got Hassan Ntenga. Hassan's a project manager at PATH, who are a NetHope member in Tanzania. And that's a global organisation that works to accelerate health equity by bringing together public institutions, businesses, social enterprises and investors to solve the world's most pressing health challenges. Hassan was integral really in gathering the requirements for the tablet in Tanzania, and we're very fortunate to have him and PATH support in leading the field user testing in Tanzania with 15 community health workers. So we're really pleased to have him here with us today to tell us about kind of his real experience of testing this tablet in the field. So that's enough from me. I'm going to hand over to Hani now, who's going to kind of speak to you where this initiative was born from. So Madeline, next slide, please.
Thank you very much, Nicola, and very glad to be with you on this webinar today, and many thanks for NetHope for inviting us. I work for the ITU, and I co-lead a joint initiative with the World Health Organization, WHO, on using mobile and digital technologies for health. And or the main objective of this joint initiative is really to leverage the power of mobile and digital to strengthen health systems and to power health workers and health professionals. And we've been very glad to be engaged in this project in terms of formulating the ask, but also in terms of identifying the specification. And this was essentially based on this kind of vision, is that we should perceive that every health worker and health professionals around the world, particularly in the developing countries, needs to be equipped and powered by appropriate and relevant digital tools that can really be almost a part of their jobs and tasks, and which can power them to almost be a game changer in all the digital, all the type of healthcare services that they are carrying. Next slide, please. We all know the type of contexts that the community health workers and health professionals are living in developing countries, where they have to deal, with a lot of paperwork in terms of reporting and surveillance. And as we can imagine, this has a lot of challenges in terms of data quality, in terms of being able to retrieve the data, keep the data, secure the data, etc. But also it's extremely also difficult to have access to the right data at the right time, at the right place, quickly, and when at the point of care. So this is, we know that those are the type of context, and we also see that many digital services could really be super, powering for those community health workers. However, what we have seen that we didn't really find one commercial available tablet that is really designed specifically taking into consideration all the type of use cases that are relevant and most common for health workers. And we couldn't find one particular device where it can tick all the specification, in terms of being rugged, in terms of have long battery life, in terms of, have all the relevant devices and relevant features, but also at an affordable price. And knowing that, we said, why don't we push this type of ask and challenge to the industry, particularly ARM, to kind of see whether we can design a device that is specifically designed for those type of use cases, and almost a product that is designed for the SDGs. And this is something that we didn't see because most of the devices are developed and designed for other types of use cases. And so far, the private sector, unfortunately, don't see any business opportunity to invest in devices that are good for SDGs. So this is what we have done for ARM. And actually, the objective is to show you in this presentation the outcome of this. So I'll hand over now to Fiona, who can go through the process and explain and describe the final prototype.
Next slide, please. Thanks very much, Hani, and hello, everybody. Yeah, I'd like to talk you through the process that we at ARM and the wider project team have been through to take this project from the problem statement that Hani's just explained through a prototype that we've tested. So first of all, we wanted to make sure that we were investing in a device that was fit for purpose. So we carried out 96 interviews with community healthcare workers on the ground and with experts in health to understand our ideal specification. And we came up with the specification that was for a rugged tablet, so it would be able to cope with heat, dust, high sunlight and water. A tablet that would have a 3 or 4 day battery life, so it would be able to cope without being charged for 3 or 4 days if there were no electrical supply. and also a few other simple features such as front and rear camera, but also importantly that a device that was affordable for the development sector. And we compared this ideal specification to what was available on the market and concluded that there wasn't anything that matched, as Hani has said, and I'll come back to this point on the next slide as well. We also looked at the size of the market to make sure that this could be a commercially viable project for somebody. And taking all this information together, we concluded that this was a project worth taking forward. So we selected a manufacturer and we developed a prototype. And we have now tested that prototype last December in Tanzania and Bangladesh. Next slide, please. So I want to come back to this point about what is available on the market at the moment and how that doesn't meet this current need. So we compared our ideal prototype specification to the 47 closest devices on the market, and really concluded that nothing met more than about 60% of the requirements we were after. I've got an example here of 5 devices, and what this table shows is that all of the red areas basically don't meet the specification. And so if you take the 2 most affordable tablets on this table, so columns 3 and 5, there's a lot more red in those columns. So for an affordable price, it's hard to get the specification we need. And in fact, to get the specification, to get closer to the specification we need, it costs more and more money. But this isn't new technology. We're not asking for anything new to be developed. What we're asking for is the right combination of technology to be suitable for the international development sector. Next slide, please. So we decided to prototype this device, and this is our prototype. So the photo on the top left there is the device on its own. In fact, this is the happy day I took it out of the box and saw it for the first time. And the photo on the left there is the device with all of the materials and kit that we sent out with it. So I'll just talk through some of the features of the device. So it has a 7-inch screen and that can cope with high sunlight. I'll come back and talk about the screen in a moment again as well. It has a detachable Bluetooth keyboard so that the users could set it up if they do have a suitable surface and use it more like an office situation, which is a bit easier to input data. It has a 3 or 4 day battery life. We also sent the device out with this solar powered battery pack because this was a large battery that we hadn't tested before, and we wanted to make sure that we had a backup if it was required, if that battery wasn't good. The battery was fine and we didn't need the solar power battery pack, but we sent it just in case. It has a rugged case, and that's not an additional case, it's the casing of the actual device, so it can cope with water, dust and heat. It also has the front and back camera with flash, which is required for some types of simple diagnostics. Also has some other features that you can't see so well in the photo, but I'll mention them as well. Has a hand and handle strap because with the large battery, it's a slightly heavier device than users might expect, so those help to use it. It also has SIM capabilities, so you can use it for data and voice and SMS, so you can actually make phone calls on it and send texts on it. So we also supplied headphones with the device so you can make calls. It's Android based, it has various sensors and GPS, and it also has NFC capability as well. I'll come back to that slightly smaller screen and explain a bit more about that as well, because we knew when we developed this prototype that it wasn't going to be this final specification. What it was going to be was the right specification to test some of the compromises we knew might need to be made in developing a new device. So the feedback we've got from potential users was that they'd like a large screen and they'd like a long battery life, but they'd like it to not weigh very much as well. And this is really difficult. In fact, it may be impossible to achieve, and certainly difficult at an affordable price. So by sending out a device that had the battery life and therefore the weight that the users needed, but with a slightly smaller screen, we were able to ask users, is the screen size actually a key feature that you need? Because if you would like that, it will increase the weight. And when you've got a slightly heavier device in your hand and you're asked that question, it's much easier to decide whether you're prepared to make that compromise than it is when it's theoretical. Next slide, please. So this is the device that we sent out for testing. It went to Tanzania with our partners PATH, who you're going to hear from in a moment, and also to Bangladesh with our partners Empower there. And at this point, I will hand over to Nicola. Thank you.
Thank you so much, Fiona. So Hassan, it would be great now if we could just talk a little bit about your kind of the experience of testing the tablet. But before we kind of get into the specifics, it would be good just almost to sort of help set the scene and hear a little bit more about PATH's focus and who it is that you work with, particularly in Tanzania.
Yeah, thank you very much, Nicole. And yeah, and I'm very glad to be part of this webinar. Yeah, so PATH is a global organization and we work in over 70 countries in Africa, Asia, America, Pacific, and Europe, primarily to improve public health. And we have 6 areas of focus, one being vaccine development. We are very much involved in the clinical trials. And another area is on medical device, low-cost device that would be able to advance healthcare delivery in low income settings, and the likes of this tablet as well. Also, we work around strengthening health delivery, particularly at the primary healthcare level. We are very strong in digital health solutions. We're also focusing more on inventing medical diagnostic tools, low-cost, high-tech device, and also very much involved in the advocacy and the public policy in terms of making sure that the world countries have right policy that would advance healthcare delivery. Our work leads us to primarily work with the government, and primarily the Ministry of Health across all health systems, being a national level, subnational level, and up to the point of care, meaning the community level and health facility level. We also work close with the donor agencies and other organizations that are implementing health improvement intervention in Tanzania, but across the world. Yeah.
Thanks, Hassan. And obviously we've heard from Fiona there, and I've mentioned that you tested the tablet for us in Tanzania. It would be really helpful if perhaps you could just speak to the work that the community health workers in Tanzania do, where they work and some of the challenges and the conditions that they work in.
Yeah, sure. So I think one thing that I would like to appreciate is that community healthcare workers play a very vital role in healthcare delivery, particularly in Tanzania, and I think in most of African countries. They are the pivotal linkage between the community level services and formal healthcare delivery. So they provide that linkage between the community and the formal healthcare delivery. And they're primarily responsible for health promotions, like providing health education on a number of health areas, but also very much responsible for, basic diagnostics, non-clinical diagnosis, and provide referrals to, health facility if a patient, seems to be in a condition where need to attend to a hospital. So they are pretty much overwhelmed in terms of their task because they are very few in numbers, and normally they have a wide area of coverage, number of village to cover, number of clients to see. So their work really is, they're very busy in terms of advancing healthcare. And in most cases, they have limited access to information, data, working tools to inform their routine work. So you'll find them working with lots of papers if available. Some of them, they do not have anything, so they rely on their mental images to do some of this work. And also, most of them, they work in a very rural, remote area with limited accessibility to, the social services. The infrastructure limitation, the likes of electricity, network connectivity, it is very challenging. These are the environment that they normally work on day-to-day basis. And I think the most important aspect or challenge is that also their skill set is very, limited. So they're always in demand of information, guidance, support from, I'll say expert people. For instance, if it's a nurse, then they would normally need to reach out to a nurse to get some advice about certain conditions that they see a client had. So these are some of the challenges that, community healthcare workers, are facing on their day-to-day basis in terms of advancing healthcare.
Thank you, Hassan. And Hani, sort of just looking a bit further than Tanzania, some of the issues that Hassan spoke about there with regards to sort of lack of infrastructure, sort of limited access to data and tools. Are they issues that we see sort of community health workers having in other geographies and areas?
Yeah, absolutely. I think what Hassan just described is very common in so many other countries and regions. When it comes, for example, to the lack of electricity, or at least unstable electricity, lack of internet connectivity as well, and the need to carry out the tablet in some cases harsh conditions, high temperature, dust, etc. So I think this is extremely common in many other countries, and for health workers, but also probably for other types of professions as well. And what we have been doing actually, that we have looked at the most common use cases that are known for the health workers, and we try to identify what would be the minimum requirement and features that would satisfy those most common use cases. For example, we know that data collection is extremely common. And we know also that data collection, you need to be able to, sync the data, and we know that internet connectivity is not available in those types of environments. So it was important, for example, to equip the tablet with also a SIM card where you can leverage, the 2G SMS, basic SMS to, sync the data in case internet is not available. So those are, the type of features that we were able to identify that are very much common. For example, telemedicine, where you will need to, connect in some cases with some medical device. You need to take some photos. Also, you need to secure your access to the tablet, because we know that, there are some potentially private data on the tablet. So we had to be able to secure the access, and being able to identify the identity of the person who is accessing, to make sure that he is the right health worker and the health professional who is entitled to look at the data, etc. So we've been able to capture, all those types of common features based on the most common use cases, and compare between them to be able to identify and make some decisions to compromises between, what are the minimum features, and also what could be the cost. So I think the prototype that we came with, I think this is probably what you can call the best compromise that can, bring all those features together. And again, I think like what Fiona mentioned, it is not really about a new technology. It's really about bringing the right features and the right technologies together, and make sure that you can produce this at a low cost, and that will reach out to the largest common population, where we can also reach economies of scale. Thank you.
Thanks, Hani. So Hassan, just coming back to you. So you and your colleagues, you spent 2 weeks testing the tablet in Tanzania, sort of towards the end of last year. It would be really great if you could just tell us about that process, and sort of how and where the community health workers use the device.
Yeah, sure. So I'll put that in 3 stages in terms of the process that we went through. The first one was for us to get an understanding of the device and then put it into a stress testing and understanding its capability. We needed to determine if the device is up to the task, as it was going to be tested in a live system, that is being used in over 3,000 health facilities. So we had to really, make sure that we bring the device that will not compromise the service delivery in the first place. So the first phase was that, to understand the device, and then also go through the questionnaire that at the end of the day, we would want to get some information from the users. The second part was to now take the device to the users, which are the community healthcare worker and our frontline healthcare worker and health centers. And then we orient them on the device, just some few areas where we think they might struggle. And the benefit was that the digital literacy in Tanzania was pretty much high, because prior to introduction of this device for testing, they had already used number of off-the-shelf or market devices that for number of data management systems. So it was easy for us to really give them, orient them, and then leave it for use. And then the third phase is now, doing the actual interview and, trying to get their opinion and understanding on the performance of device relative to what they used to use before. So that, in summary, that is how we did go through this process. Over.
Thank you. And what were some of the reactions to the device from those that had the opportunity to use it in those 2 weeks? What were some of the things that they liked the most about the tablet, and perhaps was some of the functionality that they felt was missing or that they would have liked to add on?
Yeah, sure. So I'll start with what they really liked. And I think the first impression is that the device, in terms of performance, the speed, the response time, I think the light in the screen was really, beyond what already exists. So it was really impressive for them to use this device on these areas. The other thing that they really like is the external keyboard, particularly in the health facility settings, because it fastens their pace of typing, compared to the on-screen keyboard. So they really like the fact that they can use the external keyboard and sometimes switch to, on-screen keyboard as needed. The hand and shoulder carrier were super impressive to them, because some of their work involve mobility, moving from one place to another, weighing children, taking some stuff from the fridges, giving jab children. So they needed a device that it'd be flexible enough for them to move around with without really being afraid of damaging it or dropping it. And I think the other very super useful feature is on the battery life, because normally the off-shelf devices wouldn't last a day without being charged. So normally the sessions, they run a session up to 8 hours a day. So in between, they will needed to kind of find where they can charge their devices so that they can continue with the service delivery. So the battery life was super useful and had the capability to meet their infrastructure limitation. In terms of the improvement, one of the areas I think Fiona already mentioned, I think they would like to have a bigger screen, because one of the challenge in healthcare delivery, especially for community healthcare workers, as I've said, is access to information and data. So if you have visual, then a better screen give you more access and to make use of the information that you have. So a bigger screen is certainly what they would want to be part of the final prototype. Another issue that they were concerned is a bit reducing the weight of the tablet, because they thought it's relatively heavy compared to what already in the market. And since their work involved moving and traveling, most of them by foot across community, then a lighter device would be more, useful for them. Yeah.
That's really helpful. And you touched on there sort of, some of the real things that they liked, sort of, that external keyboard and the flexibility to move around. It'd be good to understand just a little bit more about how, what did that enable them to do better or quicker, and because of some of the functionality that the tablet brought.
Sorry, can you come again?
Sure. Sorry, Hassan. Apologies if my microphone is failing out. I was just saying, it was really interesting to hear about the benefits that the tablet, that the community health workers felt the tablet delivered. It would be interesting to hear how they felt they were able to do anything better or quicker or more efficiently than before because of those functionalities.
Yeah, sure. So as I've said earlier, so one of the great efficiency improvement is in terms of fasten the speed of registration. For instance, one of the solution of the system that they were using had to do with the registration of birth in both community and health facility level. So by using the external keyboard, they were able to register children much quicker compared to on the screen keyboard. So there's a lot of efficiency in terms of the time they use to provide care now compared to the previous devices. So they were able to see more children and they register more children with the external keyboard compared to the traditional on-screen keyboard. So that's one of the benefits. So the other part also is around also in terms of efficiency of overall service delivery. As at some point, when they were using the traditional on the shelf devices, at some point they were required to take the device to a charging station and then use paper-based tool as a backup, and then at a later stage come to enter the information into the electronic device. So the fact that this device was able to last for 3 days without being charged, that improved a lot of service delivery, meaning that they wouldn't have to cut short the service sessions, they wouldn't have to, re-enter multiple times the data from paper to electronic and so forth. So I'll say those are some of the critical efficiency gain that were brought by using this device.
Thank you. It would be really good to understand, at the end of the 2 weeks, what was the sentiment, from you and your colleagues around, whether this is something that you would want to have going forwards, both for the community health workers in Tanzania, but perhaps other countries in which PATH works in as well.
Yeah, so as I said earlier, PATH work in a number of countries, and specifically for me, my portfolio focus more on digital and data solutions. And I can see a lot of use case, not just beyond Tanzania, that are, this device suits very well in most of the countries, particularly in the healthcare or health facility level. So this device can be used also in the healthcare system in terms of installing a health medical record system, installing a health promotional system in the device, and make sure that the information gets to the healthcare workers, and information gets into the hands of mothers and fathers and children that are targeted for certain health delivery. And also, I think an additional, any community service program beyond healthcare, the device is able to really be used. I've had a chance to work in the agriculture sector before, some 10 years back. And I think this is kind of the device would also suit very much in, community service delivery, like farm extension services. They could easily use this device to advance, productions. Yeah.
Thanks, and that ties you very nicely onto sort of a question that I actually have for Hani, and is linked to a question that we've seen come in from Sarah, which is, aside from, the healthcare space and community health workers, Hani, it would be great if you could sort of speak to some of the other use cases. Sarah, and the questions here is asking specifically around agriculture, which Hassan's just referred to, but it'd be great to hear from you some other areas where you think the tablet could be used.
Yes, thanks, Nicola. And indeed, I fully agree with what Sarah put on the use of the tablet for other use cases, particularly in agriculture, but not only that, for education as well. And while this project was really the entry point was the health use cases, but from early on in the project, we were very keen and very aware that this device needs to be also relevant for other use cases for many, many reasons. Because if we would like to bring this device to, reasonable prices, it needs to have a very, very large demand and market. Otherwise, the cost will be quite high. And we all know that, the big sectors like education, where you really can have huge demands, agriculture, there are huge populations and live in rural areas, etc. So we've been very keen to make sure that, the features are also cross-sectoral. There are a lot of examples, like just the fact to have a keyboard is super useful for education, where, students and teachers, it's much easier for them to use, to use the keyboard. Just the fact that it has the also the SIM card at the same time, it can facilitate access to financial services that are extremely relevant for agriculture, but also for many other types of use cases. The fact that, the camera, and I think this is the example that Sarah provided, it could be used, to capture pictures of, like an apple with some sort of a disease, and could be sent, for a remote expert to provide some, diagnosis and provide some, ways to address this type of disease, etc. So it would be quite super useful for advisory services, also for all types of e-learning and capacity development, which we know it's very much cross-cutting across sectors. That's why we've been very keen to make sure that the screen is big enough. And we know that for this particular prototype, the screen was a little bit small. Maybe Fiona can explain this later. But ultimately, in the, if we would like really to produce this on scale, I think the screen needs to be a little bit bigger, because we know that this is important for learning purposes, where you can really consult, multimedia, content, and also where you can show this content to others. One very important thing, I think it's worth to say, that it is not because this device has been designed to work in low resource settings that it needs to be, the cheap, low cost, low quality, low standard type of device. I think this is extremely important, and people, even if it's in very low resource setting, people still need to feel that they have a good device. A good device that is performing, that is fast, that is robust, that is durable, where you can really have good screen, you can really see good enough, you can browse internet no problem, etc. So I think this was very keen. It's not about low quality, low standard type of device, but it's like a quality device that is designed to fit for purpose. And it is done also with all the right measures to make it as affordable as possible. Thank you.
Thank you, Hani. I guess just a final question for you both, Hani and Hassan, from me, is, you've been involved in this, Hani, since it was the seed of an idea. And I guess it would just be really interesting to hear from you, sort of, what are your hopes for the tablet as we move forwards?
Thanks, Nicola. See, I think with this prototype, I think, as I mentioned at the beginning, the main idea is that we need to, talk to the industry and say that there is a significant and real business opportunity to develop products that are designed to work in low resource settings, or you can call it for SDG in general. Most of the businesses are looking for use cases, for wealthy environments where they can get like big margins, etc. And I think this prototype is a proof of concept to say that if you develop products that can work in those types of environments, there is a good business case. And actually, I think one of the main hope and the main, desire maybe out of this webinar as well is to find, entities, individuals, startups, distributors who are willing to, take this as a business opportunity to venture into, working with the project to say, I would like to, to be, the supplier for this region or for this country. I'll take, the investment needed to, to promote and to sell and to maintain those types of products, etc. And I think this is what we really would like to see, is that this being picked up by business-oriented type of entities, or maybe social businesses who are really looking to sustain themselves, but at the same time, do good. And I think this is one of the good investment, because many of the other types of products, they don't have a clear business model. But I think for this product, this is a concrete product that it should be sold. It has a price. You can benefit from it, you can profit from it, but also do good at the same time. So I think this is one of the things that we do hope to see, that local and regional suppliers and businesses and maybe NGOs, maybe also UN get interested, and they would like to venture, and they would like to see how they can invest and order and deploy this product in their development projects.
Hani, Hassan, thank you so much for sort of answering my questions there. It's great to see lots of questions coming in thick and fast from attendees, which I'm really pleased to see. Before we crack onto those, I'll just hand over to Fiona really briefly for some final comments.
Thanks very much, Nicola. And thanks to Madeline and the NetHope team, and for all of you for listening today and giving us the opportunity to tell you more about the project and what we've been working on. We have a couple of questions for you, and then there's time for you to ask us some questions. So keep those questions coming in. So we have been working on this project as part of our social impact program, looking at technology for good. We don't actually build and sell devices. So we're now looking to find the right commercial partners to take this forward. We've been involved because of our interest in tech for good and because of our strong partnership with Be Healthy, Be Mobile. So we've now been able to prove that this solution is technically feasible and it will actually solve this use case. And we've gone a long way to proving that it's a commercially viable solution as well. So our first question to everybody is, to help us prove this is commercially viable, we're looking to hear from organisations that would be potentially interested in purchasing it if it existed. It's not a commitment to purchase, it's just an interest in purchasing. So please get in touch with us if you think this device is something that could be useful to you. And also, if you have links to those that are bulk purchasers, such as governments or funds, then again, we'd love to hear from you. And our second question links to something that Hani's also mentioned as well, which is we're looking to fill all the parts of this value chain. So if you're involved in and would like to be part of this project, from the marketing and sales, or the inventory, or the distribution, or the after sales and repairs and maintenance, we'd also like to hear from you. We need to fill all those parts in that value chain. Because we really want to make this much needed solution a commercial and an affordable reality. And we want to see technology that's designed specifically to meet international development needs and to meet the Sustainable Development Goals. So thank you for your time today, and we look forward to answering some of your questions. Back to you, Nicola.
Thanks, Fiona. So I'll get cracking on some of these questions. One of the first ones we've got here from Frederick, and actually Hassan, maybe I'll ask you to answer this one as somebody who's had experience in testing using other devices as well. And Hani and Fiona, please chime in as well. But Hassan, in your experience, what's some of the greatest shortcomings of other commercial devices to satisfy the needs of community health workers?
Yeah, so thank you very much. That's a great question. I think, yeah, so we have a leverage to work in one of the region, and now it's been 5 years down the road with the commercial available devices. So one of the greatest limitation basically is on the battery life. So, for instance, we were using the electronic registry as a solution to be used in that tablet, which means that it has to maintain power from maybe from the morning for about 8 hours in a day without a need of charging and all the stuff. So sometimes it has to be able to, register 2,000 children a day. So you'd see the capability needs of the device. So normally, what we really find is that the battery life wouldn't really suit, and at some point they had to provide them with a power bank in the middle of the session. And when the battery go below 10%, the screen light become too low to be used. So that really, it wasn't really useful. I think the other part is on the processing power in terms of, ability to handle local data without really compromising the efficiency of the tablet in terms of, the use and feel in terms of, if you want to navigate, the device become too slow because the processing power is already overwhelmed with the data that has been captured locally. So I'd say those two are were very common issues, and were very, stressing issues that we couldn't really solve. Yeah.
Thanks, Hassan. And whilst I've got you, I've got another question which you're probably best placed to answer from Sherilyn. And that's around the screen and whether you experienced when using the device in Tanzania, whether the screen has any issues when it's utilized in dark or bright safe environments. And Fiona, you might want to jump in here as well with some of the testing that ARM did in your facilities also.
Yeah, so I think one of the greatest benefit is that it was able to respond to the light differences between external environment and, when you use the the tablet indoor, because when we're doing the testing were used in both situation or both environment. There are some of the testing that were done in closed area, sort of health facility environment. The other were used in outreach, where you normally work on the sun and maybe in somewhere in a tree. So I think the adaptivity, the screen was able to adapt into the light situation of the environment that we're working on. Yeah, maybe Fiona can add more about that.
I don't have anything to add on the screen. What I will add on the testing is that we did some additional testing in the labs on the heat that the tablet could cope with, because we knew that the temperatures in Bangladesh and Tanzania at the time of year that we did the testing were not as high as they can reach at other times of the year. So we did some additional heat testing to ensure that the device would be able to cope at the kind of temperatures it might need to be used at in the field.
Great, thanks, Fiona. And we've had a couple of other questions with regards to the software and the apps that we utilised whilst you were testing the tablet Hassan. Perhaps you could just talk about some of the specifications that you guys used, and then Fiona, perhaps you could just add a few points on how the tablet's been developed with regards to apps and software usage.
I'm happy to start the answer to that question. So yes, the apps that we were using on the device were all apps that already existed for healthcare. So they were already accepted healthcare apps that are used on mobiles and tablets currently. And so we were just able to transfer those over to our tablets. So from that point of view, we weren't trying to solve a software problem. There was already great software out there. We were trying to solve a hardware problem to make sure that that software was available to those in these more challenging environments. And so our tablet needed to be built on Android so that it could run those apps, because those apps had already been built for Android.
Thanks, Fiona.
Yeah, so specific in Tanzania, we tested the device only. We have one of the mobile health solution called the Electronic Child Health. And, it's a mobile application that runs in Android. So we basically installed that application and gave it to the healthcare workers for testing. Yeah, before even this device, the application was installed and tested in the device that already exists in the market. So it was just a switch-off device. And also we tested on the had a DHIS2, the District Health Information System software, which is web-based and used mainly for routine health, routine reporting of health service delivery. So those are the two systems that we tested with.
Great,
So Nicola, I think
Yeah.
maybe just to add maybe one quick point, I think the underlying principle is that we wanted that these tablets work as any other Android-based tablets, that there is no particular learning that you need to know or to have to be able to use a tablet, so it could be really adopted immediately. So we've been very keen to have it like as all the mainstream other tablets, Android-based.
Thanks, Hani. That's a really helpful clarification. Fiona, there are a couple of questions that have come in with regards to the specifications of the camera. Just wondering if you could perhaps sort of specify anything there, and perhaps Hassan, how the camera was able to perform in any pictures that were needed to be taken whilst conducting the testing.
Nicola, was there a specific question about the camera?
It was just around whether, would the camera be able to shoot pests and diseases on plants and animals? And I think there was another around the camera, would the camera, how good is the camera at scanning physical documents in the field for transmission as well?
Okay, thank you. Yeah, so we developed the camera to make sure that it was suitable for taking photos of any ailments or for future proofing for any telemedicine. So it was tested for that and passed those tests. We didn't test it for scanning documents, and if that is a useful use case, it would be great to hear more from the person that asked that question. So perhaps send us an email after this, and we can explore and do a bit of extra testing, see if it will be suitable for scanning documents. It wasn't a use case that we tested this time around.
Yeah, I can add into that. So one of the solutions that we tested with required scanning a barcode, 2D barcode ID as a unique identifier. So one of the challenges we had also faced with some of the existing in the market device was that some of the camera could not really scan the 2D images, barcode images, and translate into the appropriate number. So we had to we're using the already existing device in the market, we had to kind of install an external scanner, Bluetooth scanner, to be able to scan and read the barcode ID easily. So with this tablet, it was possible to use inbuilt camera to scan for 2D images. Yeah.
Thank you so much, both. And aware we've got only a few minutes left. I think there's possibly just one last question, which I'll come to you on, Fiona. And that's just around the solar power solution. This question here from Frederick, just around, clarifying that, could you discuss the solar power solution a little? It sounds like it charges the battery pack, just some clarifications on how long does it take to charge the pack, and when charging the tablet, and how long does it take if it's completely out of power to charge it back up?
Yeah, I'm happy to answer that. So we didn't need the solar power bank in the end, but it was intended to power up the battery should the battery drain. It didn't, but we did test it nonetheless. And so it was a large battery. It was a 12,000 mAh battery, and it takes about 6 hours to charge it, and would have taken about 6 hours to fully discharge to the tablet. That wouldn't have fully charged the tablet. It was only a backup. That is one of the drawbacks of having a large battery in the device, is that a large battery takes a long time to charge as well. And that will always be the case. We are now looking at any ways of improving the cabling and optimizing the charging so that we could reduce that time. But there will always be that issue with a large battery taking a long time to charge, but we hope the benefits are outweighed by not having to charge the device when you're in the field, especially if there is no way to charge that device when you're out. Thanks for the question.
Thanks, Fiona. And I think perfect timing that ends all of our questions. So Madeline, I'll hand back over to you.
Thank you, Nicola. And thank you to all of our speakers for today, Fiona, Hani, Hassan, Nicola. A great presentation, great interview, lots of great questions answered here today. Thank you also to our attendees. A great turnout for today. Thanks for being interactive. And please take a moment to complete our short webinar survey. We appreciate your feedback and hope that we can answer any further questions that you might have, or get you in contact with Fiona if you'd like to make that connection. And do look for a follow-up email later today with the links to the recording for this session that you can share broadly. Also, it will contain, the link will contain presentation materials and other links to more information. So thanks again for attending today, and have a great rest of your day.
Thank you.
Thank you. Bye.
Bye.
Thanks,
Bye.